Injuries to the eye, they're different. So when a patient comes in with multiple injuries plus ocular trauma, alkali burns, acid burns, foreign bodies, visible or not, the eyes can't wait. The Morgan lens provides a fast, bilateral, hands-free method for emergency eye irrigation, one that gently irrigates or delivers a controlled dose of antibiotics to the cornea and conjunctiva. Immediate treatment of the eye calms the patient and makes it easier to work on other injuries. Transporting your patient to or throughout the hospital is possible without having to stop the irrigation process. Just like over 90% of the emergency departments in the United States, you should be using the Morgan lens. Once inserted, the Morgan lens floats on the very layer of solution it provides. Designed to fit the natural curvature of the eye, the lens protects the tender ocular tissues and vaults the cornea, never touching it. As the lens floats above the eye, preventing further damage from eyelid movement, the flushing process soothes the eye and provides instant relief to the injured tissues. When treating severe infections, doctors have used the Morgan lens for continuous eye irrigation for 7 to 10 days or more, removing them only long enough to examine the eyes. The Morgan lens is simple to use. First, if one is available and the patient has no allergies, instill a topical ocular anesthetic. This isn't essential, but it may help calm the patient. However, when removing non-embedded foreign bodies, it may be best not to use an anesthetic since it could mask the foreign body sensation. Peel open the sterile packaging and attach the Morgan lens to the Morgan lens delivery set and a solution of choice. The delivery set allows you to easily irrigate both eyes simultaneously, or just one eye using the pinch clamp. You may also use a standard IV set or attach a syringe if you need a smaller, more controlled application. Begin a minimal flow. To insert the lens, have your patient look down. This exposes the less sensitive sclera and protects the cornea. Insert the lens under the upper eyelid. Have the patient look up, retract the lower lid, and drop the lens in place. Adjust the flow to the desired rate and absorb the outflow with Mortan's Metaduct or towels. The Metaduct conveniently wicks the fluid away from the patient and into a basin or other collection device. To prevent the accidental removal of the lens, the tubing may be taped to the patient's forehead as shown. Experts recommend continuous irrigation until the pH returns to normal. This may take hours or even days. To check the pH or to instill additional anesthetic, you don't need to remove the lens. Simply pinch the tubing to briefly stop the flow of solution and touch a piece of pH paper to the conjunctival fornix. Removal is just as easy. With the solution still flowing, instruct the patient to look up, retract the lower lid, and slide the lens out. Once the lens has been removed, stop the flow of solution and place the lens in a clean location. Recheck the pH after 10 minutes to ensure that it's remained neutral, and repeat the irrigation process if necessary. When finished, dispose of the lens properly. Again, to insert, have the patient look down and insert the Morgan lens under the upper eyelid. Have the patient look up, retract the lower lid, and drop lens in place. To remove, continue the flow of solution. Have your patient look up, retract lower lid, and slide the Morgan lens out. Once the lens is removed, terminate the flow. No other method of eye irrigation is as simple or as effective. Consider the alternatives for a moment. Traditional methods of eye treatment are inefficient and ineffective, but the Morgan lens is so easy to use. Non-embedded foreign bodies, even the kind that can't be seen, are removed effectively and thoroughly. The Morgan lens is the only device to provide a positive and multidirectional flow throughout the cul-de-sac, keeping the cornea, conjunctiva, and normally untreated inner eyelids thoroughly flushed. Experts have said that regardless of the chemical involved, immediate and copious irrigation is most important. Contraindications include a protruding foreign body, a penetrating eye injury, or suspected or actual rupture of the globe. In all other cases, begin immediate irrigation and wait to perform a more detailed evaluation or history until treatment is underway.